Congratulations, Dr. Ablaza, on being named a top 25 leading woman entrepreneur. It's a pleasure to have you with us this year.
Well, thank you so much. I'm honored.
Absolutely. And you do so much with, building women's brands and helping them feel their best. So tell us a little bit about the work that you do.
Well, I'm a plastic surgeon, and that includes cosmetic and reconstructive surgery.
Okay.
And I have a private practice in Montclair, and I've been practicing for 19 years.
Okay, so was it always your plan to be, in this world, or was it always your plan to be an entrepreneur?
I think it was. I always wanted to be in medicine, so I knew I wanted to do that and be a surgeon and then a plastic surgeon after I started doing it in residency. And I really wanted to get out in the world, and I thought that I could do more in the world in general than in an academic institution. I think that people know which direction they want to go, and you figure that out while you're in medical school and residency, what feels most right, and that was right for me.
Right. So in terms of the way that, you've helped women over, the past 20 years, what are some of the things that you provide to them?
Well, I think that women are very rare in the plastic surgery world. There's only, I think, 1 out of every 9 plastic surgeons is a woman. Mm-hmm. So there's a limited number even in this country. Maybe there's, 700, a small number. And 90% of our clients are women. So you're trying to match up women with women. And I think that I hear their issues differently. I do a lot of breast reconstruction and just a lot of breast surgery in general. And I think that as a woman, I can relate more to their problems and their issues. And I think that they feel like a better connection, maybe in some ways, to a woman.
Absolutely. I'm sure you can empathize.
Yes, definitely.
More so. So what is the best part of your job for yourself?
The best part of my job is definitely the satisfaction I get from helping people and changing lives. I think that we really are lucky to be in a very intimate part of people's lives and to partake in helping them feel better about themselves or fixing something, reconstructing something, and to see the look on their face and changing lives. And I think that that goes a long way.
Right, you have such a huge impact on someone's life, so it must be very fulfilling.
It's very fulfilling, and I think that's what keeps you going is the satisfied people, the grateful people, the cards, the letters. Really, it's really something that keeps you going.
So, what would be some advice you would give to a woman who's considering a career in your industry?
Well, I think it's a hard road. It's getting easier because I think even in medicine in general, there's a higher number of women than there used to be. Maybe it's getting close to 50%. Mm-hmm. But I think you just have to keep focused. And I think that sometimes when I was going through it, I was very rare in the field. Even in medicine in general, maybe 25% were women. And I think you just have to not allow all the politics of it and all the social pressures affect you, and you just have to keep focused and just be true to yourself and smile and do your best, but not to cave into the pressures. And if you want something bad enough and you focus on it, you can reach your dreams.
Absolutely. So being the change is our theme for this year's event. How do you envision yourself being the change?
Well, I think that in my practice we've set up the Breast Hospital of New Jersey, which is sort of taking something in women's healthcare and trying to make it a one-stop shopping. So we have breast surgeons that do all the diagnostics for breast cancer, including the radiographs, the mammograms, the MRIs, the ultrasounds. The breast surgeons also can do biopsies on site and have everything done there. If someone has breast cancer and they choose reconstruction, in the same building, we have reconstructive surgeons that can meet with the patient same day, even if they want to get their diagnosis. And then the surgery can be performed in the on-site surgery center. We do ambulatory same-day surgery. People go home after their mastectomies and reconstruction. And so it's taking away all the delays that tend to happen, a week or two between tests, a week or two between, going from one doctor to the next. And we're trying to make it be just easier and sort of, I don't know if you want to call it holistic approach, but sort of combining different specialties into one building and making it, really, it's a benefit for the patient.
Right. What core principles have you used to build your business?
Well, I think the main thing was I wanted to create a center of excellence in providing healthcare using the highest standards in the industry, basically. And that means patient safety, risk reduction, and it's all about the patient, number one. And number two, really quality over quantity. Mm-hmm. You know, I never wanted to be part of a business that was a factory for, you know, breast augmentation or facelifts. I'd rather have more personalized care. And really, I don't care about numbers. I just want to give the best care and in the safest way. All board certified practitioners, all the certifications up to date for the facility and that sort of thing. And then in terms of your staff, always invest in human capital. Mm-hmm. You know, finding good people to work with you. And it's not just about a resume, what's on the paper, but it's meeting someone and connecting with them and people with nice personalities, kind personalities, leaders, and team players. That's been very important, and it's been successful. We have employees that have been around for 15 years. So it's really great.
Well, that's a real testament to you as a person and as a business leader, and I couldn't agree with you more. So congratulations again on your success.
Thank you. Thank you.
Great.